Welcome to Your Pharmacy Career Podcast, proudly produced by Ravens Recruitment, the experts in pharmacy career and locum services for over 30 years. Every episode is your gateway to new opportunities in the pharmacy profession. From expert advice to inspiring success stories, we're here to spark ideas, guide your career, and help you achieve your goals. Stay tuned. The next step in your pharmacy journey starts here.
Hi everyone, welcome back to your Pharmacy Career Podcast. As you know, I'm your host, Christy Patterson, and today I'm joined by a true innovator in the world of pharmacy, Lusi Sheehan. Lusi is a wound care consultant, an accredited HMR pharmacist, and the founder of the Wound Educator. From helping to establish pharmacy-based wound and compression clinics in Western Australia to launching an accredited training course for pharmacists, Lusi has dedicated her career to improving wound care literacy in the community. Lusi, thank you so much for joining us on the show today.
Thank you, Christy, for having me.
Now, Lusi, I ask everyone the same question when they come on the podcast, and so I'm going to ask it of you as well. What initially inspired you to pursue a career in pharmacy?
Sure. My mum was a nurse and she influenced me to do something health related. So I chose pharmacy and optometry as my first top choices. And this was in Brisbane. So I got those two offers and Monash was one of them in Melbourne. So that was Bachelor of Pharmacy with a commerce double degree. And then this other one was optometry in QUT. So I thought pharmacy would probably be more general health, where I might learn more about health and health conditions. So it could be a bit more useful. And it was also quite exciting for me to just explore a new city in Melbourne, being 18. So just took the dive and moved over to Melbourne and started in pharmacy. But I also read about the career path, and part of that was care of patients through counselling and advising them on how to improve their health. So that was appealing to me.
Yeah, that sounds so like a lot of pharmacists actually that I've interviewed on the podcast. There always seems to be a common theme of like helping people, or that care part, which I think is really, really interesting. Now, once you graduated and did your internship, have you always worked in community pharmacy, or what was your career transition like in those early career days?
I did spend all of my career in community pharmacy, and that was after intern. I was working as part of the community pharmacy group in Melbourne and managed a pharmacy, and then that's also where I started learning about wound care through a workshop and other health services. So also part of my degree with Monash, we went to a placement overseas in Iowa, which is in the middle of US, and went into a small independent pharmacy. And it was very health focused and services orientated. They had lots of services like vaccinations and bone density, cardiovascular screening, and lots of different areas. And that really attracted me into going into community pharmacy and focusing on those health services aspects. So that was where my orientation was. Then in about more than 10 years ago now, I moved over to Perth and joined a pharmacy group in WA that's also very health focused and patient services orientated. So big focus on pharmacists being in the front of the consultation area, providing health advice. And that was great, because that meant also like spending less time in the dispensary, which is not a part of pharmacy that I enjoy being in all day. So certainly that way inclined. But there is certainly a part of my career that I felt like, I'm a bit stuck in this space of community pharmacy. I do want to explore, and I did actually consider going into hospital, but various factors and the owner at the time also encouraged me to stay in community pharmacy and upskill in an area that I was interested in, and also offered to provide support in providing funding for the postgrad that it did with Monash in wound care. So that also led me to stay in community pharmacy and focus on continuity of care, which what I found was really important to me is that continued care and building those relationships and trust with those patients, and they come back to you and you get to know them over time. And also the HMR consultancy, so that also allowed me to stay in community so that I can focus on the clinical aspects and viewing patients in their home. And so it did evolve over time, but certainly, yes, for the all of my career, I have stayed in community.
Well, you're very much like me. I am a community pharmacy girl through and through. I've never worked in anything else. But I think community pharmacy, especially probably when we, like 10 years ago now, when we first started, it looked very different to what it does now. And I think it opens a lot of doors that you probably don't realize when you're a student. And I actually really love the fact that when you were feeling a bit stuck and you reached out and spoke to the owner or your manager of that pharmacy at the time, and they mentioned to you, well, what are you passionate about, and is there a way they can support you? So I think that is really amazing that you are happen to be working in a pharmacy that is so supportive of their staff and helping them find their passion. But with the wound care, was that something that you're always passionate about? Like, I think it's something that, like, wounds are, to most people, are a bit gross. And I've also heard some pharmacists say, oh, I don't want to touch patients. That's why I became a pharmacist. So was wound care something that you were always drawn to, or was it something that over your career you saw that there was an opportunity?
Yeah, absolutely. So I mentioned that when I was managing pharmacy in Melbourne, the group actually got Jeff Sussman, which is the professor of wound care, which I see as my mentor and the guru of wound care. So he did a workshop for us and he showed us acute chronic wounds management in the hospital that he was working at in Austin Hospital, and the team of specialists and allied health that he worked with to help with really chronic wounds like leg ulcers, diabetes, foot, and all sorts of weird and wonderful wounds that I've never seen before. And he also just honed down on those really basics of wound care, like moist wound healing, the use of antiseptics, and the safe versus harmful use of potentially cytotoxic antiseptics that I never really knew about. Oh, I did learn a bit about that in the pharmacy degree, but it didn't really stick until he gave us that workshop and took us to the place where he actually provides specialized wound clinic. So that really opened up my eyes to how much I didn't know about wound care. So most pharmacists, I would be giving out antiseptics and just plasters or whatever the patient wanted. And a lot of them just wanted something really quick, like Band-Aid solution to help with covering it up, or even just leaving it open to dry it out, or just using alcohol wipes to sterilize the wound, which I know now that it is all misconceptions, and those are really traditional practices that are really outdated. But back then, I was completely oblivious or ignorant to that. So it was more of a transactional thing where I just give out what patients think they needed, because I didn't really know any better. But since doing the postgrad degree in wound care, that really helped me understand how a wound heals and the factors that can impact on healing, and those medical conditions or medications, and how to allow the wound to heal in its natural environment that is ideal. And that's what we now recommend. The things that we recommend is based on assessment of this patient, and not just the wound, but those factors like those psychosocial factors, their lifestyle factors, and how adherent could they potentially be to treatment plans, and what type of antiseptics to use, and when is it appropriate to actually use a certain dressing, or when is it unnecessary to refer them on for further assessment. So those things I've learned through actually upskilling myself in this area, and became more and more aware of those problems with current practices in wound care, whereas I just didn't know about that in the past.
Yeah, I can definitely relate to that. And I've not done a postgrad in wound management like yourself, but just, sought out training from suppliers and things like that. And I actually was in a workshop as well many years ago by Gary, and I had that similar realization. I was like, oh wow, I probably, like you said, I probably did learn it at uni, but you can't remember everything from there. And yeah, sometimes those things that might seem a little bit trivial, do you just, I guess, provide what the customer is asking for? And I didn't really give it a second thought. And so, yeah, learning about, yeah, just proper use of antiseptic sounds so basic, but it did kind of change my practice, absolutely. So once you did your postgrad, what was the trajectory like after that? Was it something that you then, like obviously now you are the wound educator and very well known within our industry about, yeah, upskilling pharmacists in wound care. But I imagine that took some time after doing your postgrad. You don't just all of a sudden, okay, so now I'm going to be the wound educator. So what was your, I guess, impact after doing that postgrad?
Yeah, absolutely. It was a bit of a journey to work out what do I do after the degree. So the intention was to help improve wound care practice. So that led us to establishing a wound care service within the pharmacy that I was working at. And we had a service orientated model where we had more than one pharmacist on. So there's often overlapping pharmacists and two or more at a time, and with other support staff. So it's a small community pharmacy with higher demographic of elderly population, and we'd get wounds of all sorts, with just minor cuts and grazes to skin tears to burns to post-op wounds and even leg ulcers. So a lot of that, I really saw the demand come through and was trying to work out how to utilize my knowledge from the degree and put those theory into practice, because it doesn't actually provide you hands-on practice. It gives you a lot of theory and understanding and assessments through assignments and case studies, but it's the hands-on practice that I really learned from the most. And so worked out a plan with the owner and the team on how to provide this service for our community and have a structure and protocol in place of the range of products and dressings that we have and how we assess the wound, having sort of things like photography available and documentation, consent forms, service forms, and all of those in place to be able to provide that at a level that we believe is a quality professional service. So it was quite a bit of a time-consuming exercise or project, and through a lot of trial and error of working out what is going to be accessible in the pharmacy, what's going to be affordable, because the course teaches you so much about different types of dressings available, about all sorts of conditions from chronic to acute. But a lot of those wounds we don't see in the pharmacy, and a lot of those dressings we can't access from the community pharmacy perspective because it's due to cost or because of it's just not available for ordering through our regular suppliers. So it's really working out those specifics and then creating a business plan of how to actually value our time and put a service fee and the new range of dressings that we have that are advanced and the topical antimicrobials that can't really be found in other pharmacies generally. So and that of training for the team and the education so that all the pharmacists and the assistants are on board with that basic level of knowledge and understanding of what to do when a patient comes in asking for plasters or an antiseptic. So really having that team being on board with those messaging and then getting them to refer to the wound care pharmacist and make bookings so that when I'm there, their bookings are done and I see the patients. I go into the consult room and it is a one-on-one dedicated time. We sometimes would have patients walk in and then we try to also help them, but it just doesn't work as well if you're just in and out of the pharmacy, going to the dispensary, checking scripts and doing other services. So really had to work out, how to dedicate this time to wound care and actually book out those times to be able to do that for patients properly.
Yeah, you're absolutely right. When you talk about that, you really do have to find the time to be able to do that. And then after you, I guess, established this clinic and supported your team, you obviously had to do some education of your team to bring them on the journey as well. Is that what led you to decide to launch the Wound Educator platform. How long did it take you to kind of realize that this was, I guess, a gap in the market and in our industry with wound care education? And why did you decide to do it, really, I guess is my question.
Yes, that's a good question. Well, it is very much something that we need to upskill in, because it's a lot of the time it's not a priority, where other things might be diabetes or cardiovascular disease are the priority conditions, where wound care is sort of sidelined and there's not a lot of training and education available. So I worked through the group, which is Pharmacy 777, that really supported training in this area. So we created workshops for the whole group that allowed pharmacists to attend and have this hands-on practice and workshop and experience, and also getting support from companies with dressings to help the pharmacists understand how to utilize them, and then having those documentation tools available that pharmacists are also able to use in their own teams and pharmacies. So this started from there. And then it grew from also a change in my circumstances. I had a kid and went on maternity leave and came back, and it was a very different priority for me, where now I have to look after my family and prioritize my child. Being the main carer, I can't just go into work and go back full time and run the clinic. So it was really trying to think about outside the square of how to utilize my time better to create more impact, and also allow other pharmacists to do what I can do. And my time is limited, my resources are limited. And even if I see patients, 8 patients a day, 5 days a week, I'm still only able to see, 40 patients a week. So what about all these other patients who do need help, and in all different areas and locations? It also wanted to look into funding, because one of the barriers is the issue of funding. So patients are paying out of pocket with private, and it can add up to quite a bit, sometimes over $100 for a wound assessment and treatment plan, because of the cost of the wound treatment as well as the dressings and products involved. So looked into different areas of funding with private health, government and organizations, but a lot of roadblocks. And one of the things was there's no data available to how pharmacists treat wound in the pharmacy. And because not the majority, actually the very, very minority or handful of pharmacies actually provide wound care, there's no evidence to suggest that we are providing this service in the community. Most patients didn't know about it either. So I decided to do a study, a research around this to help collect and build the evidence as well. So we did a research project with UWA students on the topic of primary wound care clinics and the experience of patients in community pharmacy in terms of wound care services. So we had quite a few pharmacies trained up in WA, and some of them participated in the study and got patients to provide their experience and view of the service. And we found that it was very positive. So most of them said that it was an accessible service because it was at a flexible location that was convenient and close to home, and the appointment times were flexible. They didn't have to wait 2 weeks to see a pharmacist for a wound service, and they can get their wounds treated promptly. They also thought that it was a high quality service, and the pharmacists were well trained and competent and had good confidence in providing the treatment plan, and also provided aftercare and continuity care, referral when necessary. And they said it was affordable. So even though they had to pay out of pocket, the level of service they received was really high, and they felt that it is something that was accessible and affordable for them and was valuable. So it was really, really positive. Some of the things that they did mention could be improved was the fact that there was no promotion or awareness around, these pharmacists can provide wound care. So they weren't aware that where to go, or pharmacists even provided a wound care service like wound cleaning or wound dressings and treatment plans. It was just unknown, and they didn't know where to go other than just wait at the GP clinic or go to a hospital. So it was something that needed to be better promoted. And I remember one of the patients said to us, or it was to the interviewer, was that they felt that every location should have a wound care pharmacist and service available because it's such a good service. And that really stuck to me as, well, why can't we have this happen? Because this is what the patients need, and there's a demand and there's a gap for it. And we know that a lot of GP clinics don't provide wound care services at the level that they would like to because they don't have the service resources either. And often they may have very limited nursing staff that are doing all sorts of things as well. So, and they're not as flexible in terms of how many the types of dressings that they can order and charge for patients, where we have the flexibility and accessibility to do that. So it was a more viable service model in the community compared to other sort of services that are available. And then being a part of that collaborative care team, we also sourced out other health services around the area that we can refer to if it's something outside of our scope of practice and if they need further investigations. But I would also invite them back to continue and reviewing them until they've healed or I know that they've been safe hands. So hopefully that answered your question about that, Christy.
Pharmacy Daily is a proud supporter of your pharmacy career podcast. If you're in the pharmacy world, it's a great resource to stay up to date with the latest industry news. To subscribe, just head to pharmacydaily.com.au to get the newsletter delivered straight to your inbox.
Yeah, absolutely. And I think the thing that sounds really scary to me is, how would you even approach someone to do a research project like that? For me, as you're talking about it, like that just sounds like something a community pharmacist couldn't be a part of. Like that's something that you can only do when you have a PhD. So yeah, I'm curious as to, like, did you just reach out to the university and say, hey, I've got this idea, how do we do it? How did that even come about?
Yeah, it was because I was doing lectures for UWA, and so they have 2-year master degree. And then I was doing the wound care workshops for the students every year. And so I had that contact, and the pharmacist coordinator, I reached out to him about the idea, and they said, actually, the students do have a research project that they need to do. And if you put forward your proposal for the research topic, we can see if anyone would like to choose that or be interested in it. And it had to go through this ethics committee to ensure that it is a viable research project. And luckily, I was able to get that interest from the students, and they did the bulk of the work, which is really helpful for me. And I just provided patients and the contacts and the pharmacies that were interested in participating. So it was certainly outside of my normal realm of practice, but it was through connections and collaborations and people who are just open-minded about studying something that hasn't been done before, because wound care is just a study that hasn't really been done in pharmacy at all. So there isn't any information or evidence around, and I hope to be able to provide more research around it. And I have seen other pharmacists starting to research in this area as well, which is really brilliant to also see and share. But yeah, that allowed me to start really honing in on the wound care clinics and training other pharmacists, which is why I started the Wound Care Educator platform, to initially to just provide awareness and throw out information and knowledge that I knew about, and wound care updates and training and events out there for pharmacists and other allied health to understand and know about and get involved, because it just starts from someone providing or sharing something that they might have known before to get their interest and then start upskilling from there. And then I did see a demand for even further education, and people will be asking, do you have a course? Is there something that we can enroll in to upskill our pharmacists to provide a wound care service? And that's where I started researching into what can I do to provide my knowledge specific to the community pharmacy, because it's quite a unique space. We don't have the same resources or facility as hospitals, aged care clinics. So it's working around the barriers as well as the enablers in the community pharmacy environment, and utilize that to advantage, and how to train team specific to that environment. So that's how it all started.
Now, as part of your Wound Care Educator platform, I know that you've also had the ability to do some public speaking when it comes to education on wound care. I actually seen you up on the big stage at APP, and I'm sure for some people that would actually be quite a scary experience to be talking in front of like thousands of pharmacists. Is that something that comes naturally to you, or is that something that you've had to learn to embrace on your journey as a wound educator?
Definitely not my natural inclination to do public speaking. I think I was actually it was a daunting experience initially in the past. So I would go back to maybe a few years ago before I even started the Wound Educator platform. There was opportunities to speak at certain organisations like Wounds Australia events, or there was also one that I remember from Channel 9 that I was asked to talk about the home medicine review program. And that was probably the scariest one for me. But I wanted to take the challenge and the opportunity to share the benefits of home medicine reviews to the public. And I was told that by Channel 9 that it was going to be a live interview. So there's no edits, and you've got 5 minutes to just say out those messages with clarity, and that's it. So it was no second take or anything like that. So that was probably the most nerve-wracking for me. And I remember going into the room, and there was a reporter, journalist who was like on the screen. It was probably just past COVID time, so it wasn't actually the person wasn't in the room. And I was sitting on top of this chair that was really high, and me being not a very tall person, my worst fear was actually falling off that chair. And trying to speak those messages with clarity became more of a blur. But it came out okay. And I was just glad that, I didn't make a fool of myself on live TV. So after that experience, I think everything else seemed a lot easier. In that sense, you had a better understanding of the audience. When you've got a pharmacist in a conference, you kind of know what they have gone through and experience and what they may need to know, because I've been in their position myself. So nowadays, I think if our opportunity comes up to speak, it doesn't feel as daunting, and I feel it's an opportunity to provide and send those and share those messages around awareness and improving health. So a lot of those come through collaborations and organizations that I've come to connect and work with and along the way, and they've been super supportive about educating pharmacists and upskilling assistants and the pharmacy team in this area and this space.
Yeah, no, that makes a lot of sense. And I think too, at the end of the day, if anyone's listening to this and they've been asked to speak, it's usually because you've got knowledge and expertise in a particular area. And at the end of the day, if you speak with confidence, like that will articulate through to the audience. And if you are the expert, like you have something to share. And I think if you do that from an authentic experience as well, like I've seen you present and you talk about your experiences and some of the wins that you've seen. So I think that's really powerful as well.
Yeah, I mean, a lot of it is real life experience. So I'm talking about things that have actually happened, or people that I've treated, and the wounds that I have helped heal. So these real experiences are easy to talk about because I've gone through them. So I think it's also just knowing your content, knowing your audience, and not make it about you or myself. Just it, as far as it goes, is I feel honoured to be asked to do this and take up this opportunity, but that's as far as it goes in terms of it's about me. So it's, if anyone gets an opportunity to speak out or share something that they're really passionate about, then I would say just do it and not wait until you're 100% ready.
No, that makes a lot of sense. Now, you spoke earlier in the podcast about sort of why you decided to go down this wound care journey. And one of those reasons was becoming a mum. Now, I've started my own business, so I understand what's involved. I am not a mum, but I've seen my sister go through it. And I feel like, becoming a mum while running a business is not necessarily the easiest thing to do. And so, from your perspective, what does, I guess, balance look like for you? And now that you've been doing it for a while now, did starting the Wound Educator actually give you the flexibility that you wanted out of it?
Well, I would ask you to imagine a circus act, Christine. So imagine you're just trying to walk across the tightrope, and then you've got a 5-year-old that's yelling to him like, Mom, like, play with me, and all day long on repeat. And then you've got a 1-year-old trying to climb up anything he sees, like a monkey, and you're trying to keep him safe at the same time. Like, some days you get across the line and you can have a breather at the end of the day and feel unscathed, but there's other days that you just get by it, survive, and wait until bedtime's here. And it is like a roller coaster, like a lot of parents will say. So the flexibility in that sense is there, in that I can choose when and where I want to work. But balance is still a juggling act. I would say it's certainly not less work. I'm doing more work in the home. I have dedicated work hours in the pharmacy wound clinics, which is great. So I go there, I forget about anything else, and I just focus on the patients and the wound consults. But at home, I'll be working through the hours, the late hours, or the mornings and the weekends. And it's not always ideal. I try to set boundaries where I have, this is just my family time, or I go on holiday and try not to think about work. But there are times where there's deadlines approaching, and I do have to do those work hours in those late hours and less ideal times. So yeah, I do enjoy the autonomy of being able to choose what I do and how I do it, because it's on my terms and I do it the way I want to. And but it's certainly not a easy feat, I would say.
No, definitely not. But I think, from what you've described, you have been able to achieve what you set out. I love the fact that you're still able to work in the community pharmacy, doing your wound care clinics on the set times that you allocate for it, and then be able to still have that quality time with your family and fit in the other bits and pieces within. I dislike asking the question, how do you balance work life? Because I just think that's just life in general. And there's always going to be times where it's probably a bit more hectic than others. But I guess for someone that's listening to this and is maybe thinking that they want to try doing something themselves, so whether it's they want to start a HMR business or move into education or do something completely different, what would be the advice that you give to those pharmacists thinking about stepping into doing something new and creating their own niche?
Go for it. Like, don't wait for permission. You can reimagine your role, and there's no limits to how far that goes. If you see a gap and it frustrates you, well, like, the chances are, it's probably a gap that's worth filling. And if someone hasn't done it before, be brave and be that first person to try it, and be humble enough to learn and keep learning. And having a support team as well, having a supportive work environment or supportive family, which I was lucky enough to have with my husband and his family and my family. So they're a huge support to me. Otherwise, I probably wouldn't have made this work. If, you have people like that would need meetings, and I would send my kids over to my in-laws who would happily take them anytime that I need them. Also, daycare or other. One of them's at school, so that's easier. But once they're both at school, hopefully, also you'll get a bit more me time as well. So, and it's very difficult to get that as parents. But yeah, once things settle down and you kind of get into the groove and have a structure of how you plan out your activities and your days and how to start that plan of getting in those appointments or collaborating with those people. And then once it's established, it does get easier, and it does feel more streamlined or easier to digest. in the earlier days, it can be a real mess and very unpredictable and uncertainty. But if you've got the appetite to do it, then I'd just say go for it and never wait to be like really 100% ready, because you never might be. I feel that consistent action, small steps, is more important than perfect action. And that's something I've learnt over time, is just to try and get something out there. Because sometimes I might think over a post a million times and re-edit it until I feel like it's perfect, but I've just spent 5 hours on something, whereas I could utilize that time better to have achieved something else. So utilize your time wisely, but work on those things that really value and are part of your mission, I'd say.
I hands down 100% agree with you. And I love the advice that you give on don't ask permission, because I think that's something that is really important to highlight, because I think you were very lucky that you were working in a pharmacy that is very supportive and understands the vision. And so that probably was a little bit easier for you in starting out. But I think for maybe other pharmacists that are maybe not getting that support, and don't let that get you down and just do it anyway and give it a try. I don't know if it was the same experience for you, Lucy, but like even with me starting something new, there's always going to be people that will give you reasons why you shouldn't do it, do things. But then I'll get a little message from someone on like LinkedIn or social media from someone that I don't even know, and like to say thank you. And I'm sure you get the same from people that you've impacted. And I think it's like, yes, this is why I do what I do.
Yeah, that's right. Yeah, it's those words of encouragement. And like, if you don't have a supportive team or there's organizational problems, then go find somewhere that is going to support you, or create an environment where you can support that mission and vision, I'd say. But yeah, absolutely right. There's always those people, and sometimes it's ourselves, like saying, oh, I can't do this because of a million reasons. But if you think there's a will, there's a way.
Oh, yes, absolutely. Yeah, can definitely relate to that as well, with the little voice in your head. They'll always be telling you why you can't do something. Now, Lucy, I think your career journey has been a really powerful reminder to pharmacists that you can still stay rooted in community care of community pharmacy. So I can still hear the passion that you have for patient care and doing that through a community pharmacy. You've been able to do that with your wound care business and now educate others on how to do that as well. But before we wrap up the conversation, is there anything else that you'd like to share with our listeners that maybe we haven't touched on yet?
I would say that the thing about, I think, wound care is that it's not only just that in itself. I think oftentimes I'm utilizing my skills as a HMR pharmacist, and I'm looking at the patient's medications. And one of the things is like lower leg edema. And I've had doctors also refer to us because they just can't manage their edema, and they don't have the tools like compression therapy or certain dressings and certain products to help manage the patient. So we would work collaboratively with them to manage the patient's medications and edema. And sometimes they are often just prescribed diuretics for fluid in their lower legs, when it should really be the main treatment is compression, and that then also helps to heal that wound. Otherwise, that wound may never heal, and it becomes a chronic ulcer that is just going to affect that person for a very long time. So that is a burden that is a big problem in Australia and internationally. And Wounds Australia does have a lot of information out there about surveys for patients, and it also says like about 33% of patients think it's okay to leave a wound to dry out. And I think in reality we see more than that. We see probably more than half of people saying that. So those factors, I think we can use our clinical skills to understand the patient. And then sometimes my recommendation as part of a home medicine review is to actually look at those medications and go, well, is this actually treating the underlying cause? Because lower leg edema is not a systemic issue with fluid. It's not about fluid overload. It is a local venous insufficiency problem with the calf muscle pump or with their circulation. So how do we talk to doctors about that? And one of the ways is just asking them to review that and suggest reducing the diuretic or stopping it if it's not used for heart failure or renal disease, and looking at the skin care, the wound care, and the compression as the first line treatment. And a lot of the doctors have actually become more aware of that now and started to reduce and stop those frusamides and go, oh, let's try the compression and let's try what, let's send them to you and work out, what's going to be the best plan for them in terms of compression. So finding something that is tailored and suitable for the patient and the patient is willing to use. So those things, like I think as pharmacists, it's not a standalone condition. I think it is a lot of things that pharmacists can utilize all our learning and skills and knowledge to assess the patient and not that just their wound.
100%. Yeah, it's so much more complex than just, here's just a wound, right? There's a lot more going on, especially when there's people with diabetes or other comorbidities and things like that. It can, have quite a huge impact. And even once it gets to a chronic wound stage, which I think pharmacists can play a huge role in preventing wounds from becoming chronic, that can also cause a lot of stigma and issues with people. Like I've seen some patients not go out because they're worried about their wounds because they might be a bit smelly or something like that. So it really can have a huge impact if we as pharmacists can prevent those wounds from getting to that chronic stage in the first place.
Yes, exactly. I think that's you spot on there. It's this is where pharmacists' role is key in preventing from wound infections and from delayed healing and chronic wounds. So that's exactly what my mission is, to help with pharmacists understanding that role and how to work with our allied health to improve those outcomes.
Amazing. Well, thank you so much, Lusi, for joining me on the show today. To our listeners, if you'd like to learn more about the Wound Educator or to take part in one of Lusi's courses, you can visit the Wound Educator website. We'll have the links in the show notes, as well as I'd love to get the link to that study that you did, and if we can share that on the show notes as well, Lusi, I think that would be really interesting to read. And I'm sure, Lusi, you'd be happy for people to connect with you on LinkedIn, Instagram, and Facebook.
Thank you. Yes, I'm very happy to talk to anyone, so feel free to share.
Amazing. And now Lusi also has an amazing deal for our listeners. So for anyone listening that would like to sign up to the wound care course for pharmacists, we have a 20% off coupon code. So that will be in the show notes, and you can use that to get 20% off her course. Thank you so much, Lusi, for joining us.
Thank you very much for having me.
Thanks for tuning in to Your Pharmacy Career Podcast, proudly sponsored by the Pharmaceutical Society of Australia. The PSA is committed to empowering pharmacists through advocacy, innovation, and industry-leading professional development. To become a member or learn more about how the PSA can support your career, visit www.psa.org.au. Don't forget to subscribe, share this podcast with your colleagues, and join us next time as we continue to explore your pharmacy career journey.